I've been asked why, why do we continue? How do you continue going through that? And I don't know how we would stop.
My primary role is to do post-overdose outreach with individuals who have survived an overdose, as well as connecting their family member to services. I also work on our naloxone project, where we are distributing naloxone into the community.
I'm blessed to be in this role at Health and Human Services. Seeing folks turn their lives around from extremely challenging situations is really rewarding. And there are those we don't know the outcome, but there are those that we do. And it's so great to see when folks are able to get back and have that smile again and be doing what they want to do.
My name is Matthew Herder. I'm Assistant Fire Chief at Lake Country Fire Rescue.
And this is Tesla. So Tesla's our therapy dog. One of the things that we've noticed in the fire service in general, and this is completely regardless of if you're in this county or in another one, is that this crisis crosses all boundaries. It has nothing to do with socioeconomics. It has nothing to do with male or female. It has nothing to do with if you're rich or if you're poor or what neighborhood you're in.
Narcan is a second chance for many patients, whether it's identified as so or not. I think that everyone deserves a second chance, and in the emergency department or wherever they're receiving the Narcan, that does make a difference for every one of those patients and their families.
Our interaction is oftentimes tied with people who are typically utilizing some form of the drug, and for whatever reason it gets cut differently or they get a different supplier, and their old dose is now something that's too much. The other part of it is that a large portion of what Tesla does is working with our personnel. So she's with me all the time. So obviously the people who have offices nearby me benefit more than some others. But she gets to go to all the stations and throughout the community where she's that benefit when you don't know that it's going to happen.
I've been asked why do we continue? How do you continue going through that? And I don't know how we would stop.
I think I absolutely have noticed that the stigma around Narcan and around addiction has improved, meaning it's become less. I think that it's more of a conversation that people aren't afraid to have. And I think that addiction, unfortunately, touches everyone in our community. And it doesn't have to be anyone that you acknowledge has a problem or that you perceive has a problem. It can be someone who makes a choice one time or who doesn't make a choice and who has an accidental overdose. I think that's very important to identify.
I would say it's extremely important. At the end of the day, if someone is not here, they don't have that second chance. I don't have the ability to link them to services, to get them into treatment, to help their family. That doesn't exist without Narcan or without any harm reduction strategies. I think we still are continuing to lose people every day. There are still people dying, and I think majority of us that work in this field will not stop until we see that number continue to decrease. Because that number is not just a number. That is family members, that's loved ones, that's parents, that's kids, those are people. And so I think we humanize that more.